Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hello, this is Dr. Warren, and today we're going to be talking about insomnia and Lyme disease, or Lyme disease insomnia, different sleep problems we run across frequently in Lyme disease, and hopefully we'll come across some solutions for it at the end. Many people don't know that Lyme disease frequently causes sleep problems. In the Belgium study that I reference so often because I think it's the best study on different symptoms that Lyme disease causes. It was a 4-year study done to really exemplify the most common symptoms with Lyme, and difficulty falling asleep and then still being tired upon waking up or not getting good quality sleep is one of the two big symptoms that we're tracking. Now, certainly other people have problems where you are frequently waking up at night, and that can also come with Lyme disease. So whether you're having trouble getting asleep or you frequently wake up, or we just wake up and we're still as tired as when we started, Lyme disease can, amongst other things, be a huge driving factor for those kinds of sleep problems. And really just because Lyme disease loves the nervous system, so it can wreak all kinds of havoc in your nervous system, absolutely. One thing about disrupting your normal sleep is that Lyme also, while it directly impacts the nerve, can also just create pain and inflammation. And pain is a neurological signal to stay awake and disrupt your sleep. So almost everyone with chronic pain will also have sleep problems. The old adage is pinch yourself to keep yourself awake. And it's true, if you pinch yourself, the pain signal tries to keep your body awake. So some of the sleep problems are directly related in Lyme disease to the Lyme creating nerve inflammation, being in the nervous system. And some of it can be a downstream effect of just increasing pain. And as you increase pain, you increase the signal to stay awake, and it disrupts sleep. We've already described the symptoms of sleep, which is usually can't fall asleep or frequently waking up, not getting into sound sleep, and feeling exhausted despite getting good sleep. People often use the term wired but tired, and I see this all the time with Lyme disease in my clinic. I do want to stress here that sleep is important for healing and recovery, but I want to make sure that I don't scare you or cause panic or anxiety here, because I actually get many people in the office who know they're not sleeping, know they need to sleep to get better, and are more anxious about the fact that they're not sleeping, which does not help. So it doesn't help to panic or have anxiety about your sleeping. Yes, it's true, we want to get you to sleep. And some people say things like, I can't get better unless I sleep. This is not true. This healing is more of a circle. We want to jump in and try to help things where we can. Yes, getting you to sleep would be a good step forward in helping your body recover and heal. But it is a struggle in many of my Lyme people, and it's a battle we're trying to help you with as we go. The ultimate solution is get rid of what's causing the problem, which in this case is the Lyme disease. Trying to solve the sleep problem without solving the Lyme disease doesn't make any sense and doesn't work terrifically. So we're trying to balance getting at the root of your problem, but also we want to try to help you with sleep things along the way. So we want to do both things. But I want to stress this. In my office, I do more calming people down that are worked up about not sleeping than almost anything else. You say, look, it doesn't help. Yes, it's true, but this is not helpful. Let's do some things for sleep, but let's just work at the root cause also, because that will help to unwind this pattern, okay? Obviously, not sleeping can make you more irritable, can decrease your performance, and can make you more pain, more inflammation, more fatigue, worse brain function, worse cognitive issues. We all, I think, know that sleep is good, and it will help you if I can get you sleeping. But I don't want you to panic and get so upset about the not sleeping that it becomes a huge block for you, and I've seen that too. Okay, I do think it is easy to note that sleeping better can help almost all your symptoms in Lyme. Some of the physical things that impact sleep, we've mentioned that just having more pain, certainly joint pain, muscle pain, headaches, can cause more sleep problems. That's certainly one. And then there's other things in Lyme disease, like Babesia causes night sweats. And this can often look like hot flashes to women, especially if you're in kind of that perimenopause years. So babesia can disrupt sleep because it's giving you these hot flash sweating attacks. Now also you can get frequent trips to the bathroom. So Lyme can also irritate the bladder, and the inflammation can create problems with antidiuretic hormones, makes you want to go to the bathroom all the time. Once again, that can disrupt your sleep. So there's pain, there's antidiuretic hormone interactions, there's co-infections like babesia, which can screw up temperature regulation and cause sleep problems. So it can be important to go through with your Lyme doctor, your Lyme provider, why we think we're having some of these problems, because getting at babesia or the antidiuretic hormone, kidney help, or some of the pain versus some of the interactions in the nervous system can be slightly different. And it's just important to note that this isn't all just one thing. It can be multiple things causing the sleep problem. We also want to mention that stress is the flip side of melatonin and sleep. So your adrenals and your melatonin, and just having a chronic illness can create stress on you. And so sometimes it's important to start addressing stress to sleep. That's fairly common, but I don't want to skip over these fundamental things because fundamentals work so many times. Now, your doctor can prescribe sleep aid medications, and these can be used in extreme circumstances. They are sometimes necessary. I think everyone agree they're not ideal, and they don't give you the same type of good sleep that we really get naturally. Now let's focus in on what we can do from a diet lifestyle perspective and for supplements that we constantly use in the office for sleep problems. The first thing I'm going to say is magnesium is generally very good for sleep and calming down. It does many other things, and we could talk hours and hours on magnesium. In our office, we really like magnesium threonate, and using that before bed is typically very, very useful. That is the form I use specifically if we're trying to get magnesium into the nervous system. Magnesium threonate is the most efficient at doing that. All forms of magnesium will help your nerves, but the threonate is especially designed to go in the nerves more efficiently than the other forms. Now, the other supplement that I think is useful in so many tick-borne cases is ashwagandha, that also helps calm down for sleep. Now, ashwagandha is an adrenal herb, and it is fabulous at helping people who are overstimulated. So if we have anxiety and we have neuropathy, and we have overexcited nerves like insomnia, we have things happening that are exciting and we can't handle, we're trying to bring down. When I hear the word overwhelmed, I'm overwhelmed, or those things are overwhelming, I want to think about ashwagandha because it can help energy, it can help thyroid hormones, it can help stress hormones, it can help sleep hormones. It's immune balancing. So it has all these benefits, but I think about it when I have extra things happening that I want to help calm down, then I'm more likely to reach for ashwagandha as a supportive nutrient in my Lyme cases. With the talk on the adrenals, it is important to reduce stress, and there's two lifestyle things you can really do to reduce stress from a physiological point of view and help yourself sleep better. The first is with your food. The most stressful thing you can do with your food is to have unbalanced blood sugar. And particularly the worst is when your blood sugar is ping-ponging up and down all the time. So when your blood sugar goes up and then it crashes down, your adrenals and your stress hormone has to rescue you all the time. And these blood sugar crashes and spikes are a train wreck for your adrenals. They're a train wreck for sleeping. So a lot of what we do is I have people eat things like 3 meals a day and 2 snacks. And I balance the blood sugar out by saying you can never eat carbohydrates by themselves. We need to make sure we have protein or fat with our meals. This takes away a lot of processed food, a lot of simple sugars. If you're constantly doing sugary drinks or you're spiking your blood sugar up and ping-ponging up and down, it is so difficult on the system that handles sleep. So that is a very fundamental thing you can do with food that is good for you on a brain level, and it's good for you on a sleep level. Now, the other thing we really recommend is screen time. Blue light, particularly an hour or two before bed, tells your brain to stay awake and wrecks sleep. And we are in an age where phones and computers and TVs and so much light hits us after the sun goes down. This is not rocket science. Blue light tells your brain to stay awake. We need to start turning off lights, getting rid of blue lights as much as we can an hour or two before bed. I have really found in my practice that these fundamental things, balancing blood sugar, turning off screens, a couple basic supplements like magnesium, specifically magnesium threonate and ashwagandha, can absolutely fix the vast majority of sleep problems that I come across. There's certainly more that we could be done on this, but these are fundamentals to make sure you have in place before we move on to anything more specific. The other thing we want to reinforce here is that certainly we want a tailored approach. I believe getting rid of the Lyme, getting rid of the things causing your problem is your best long-term solution. And so running good tests, knowing what's causing the insomnia in you, whether it's Lyme, but remember we have these co-infections with Lyme 93% of the time, but we want to be doing a balanced approach of attacking the bugs, helping your immune system, and supporting your body where it's breaking down. For many of my patients, that means doing things to help sleep. These things all need to fit together in a balanced and unique way for you to heal and get better. If you found this to be helpful, please reach out to our clinic. I wish you the best of health.